Omega Healthcare. Excellence in business outsourcing. Located in the heart of Bangalore, India, Omega Healthcare's main operations center is a beautiful 50,000 square foot facility, outfitted with the latest amenities and comparable to any Class A office space in the United States.
We started Omega Healthcare in January of 2004. Our mission is to be a cost-effective, high-quality provider of business and knowledge process outsourcing services to the U.S. healthcare industry. Omega Healthcare started out as a business plan developed by myself and my business partner and close friend, Anurag Mehta. We've executed successfully over the last 4.5 years and are now up to 2,000 employees in India.
And we're growing at a pace of about 100 employees per month. But the key for us is that we've been growing at this pace without affecting quality or turnaround times for our clients. We take a tremendous amount of pride in our client satisfaction and loyalty. We have over 60 clients today, 7 publicly traded companies. The remainder are small and medium-sized companies that we do work for. We take a lot of pride that we're sole sourced in 90% of our clients. Each and every one of our clients is highly referenceable, and at our current pace of growth, we have catapulted to become the #1 player in the offshore healthcare revenue cycle space. In addition to our normal recruitment process, every day nearly 100 walk-in applicants visit our offices for interviews. They present their resume and credentials to our HR team, and after reviewing them for suitability, they are given various tests such as typing skills for data entry, anatomy and medical terminology knowledge for medical coders, and aptitude and communication skills for accounts receivable follow-up staff. Candidates that pass these initial tests are then interviewed by HR and the respective functional managers for further consideration. At Omega, we offer fantastic employee benefits. Some of them include an in-house physician service, fully catered meals and snacks that are provided at absolutely no cost to the employees, health insurance coverage, and a highly subsidized door-to-door transportation service for those night shift employees whose shifts end between 2:30 a.m. and 6 a.m. Scaling to our clients' needs has been the cornerstone of success for Omega. We have state-of-the-art training facilities whereby several batches of candidates can be trained simultaneously in Omega's multiple training rooms. Employees go through a minimum of 2 weeks of training for data-oriented functions like demographics, charge entry, and payment posting, 4 weeks for AR follow-up, and at least 6 weeks for coding. Our training team is unparalleled in the industry, with experts well-versed in their respective domains, having years of operational experience, along with their ability to effectively impart their knowledge on new employees.
We have corporate values we have developed, implemented, and strictly follow at all levels of the organization. Our corporate values are customer service, respect for the individual, transparency, equal opportunity for all, and collaboration.
Security is of paramount importance at Omega. Entry to all production floors can be accessed only through a combination of a digital security card, along with a biometric access mechanism. Our production floors are completely paperless, and except for certain management employees, none of the operational staff have the ability to print or copy anything because access is completely disabled. We utilize our desk space effectively around the clock, wherein the same desks that are utilized primarily for data entry and coding functions during India daytime are also utilized for AR calling during India nighttime. Constant operational feedback is critical to our success and client satisfaction. So each shift begins daily with a quick debriefing session from a team leader who shares client updates, along with feedback from the Omega Quality Assurance team from the prior day's work. Omega has expertise in both physician and facility coding, where we adhere to a high accuracy standard of over 95% and also strict turnaround times. Over a third of our coders have achieved their CPC certification from the AAPC, and Omega is making the investment to continually certify more and more of our coders, including a HEMA certification. We can code directly onto the charts or into any coding software application. Our data entry staff is not only lightning fast, but their accuracy is also extremely high. Our telephone-based staff goes through extensive training not only on the healthcare revenue cycle domain, but they're also provided with essential voice and accent training to minimize any issues on the U.S. end.
Hi Christy, how are you doing today? Thank you. Well, the policy number is 1213456. Okay?
The doctor's name is Dr. Chris Tucker. My patient's name is William Ross, and the ID number is 168-869-521, A as an apple.
Yeah, and the date of service is on 12/4/2007 for the total charge of $1,671 even. Sure, no problem.
And I'm checking on a claim for the date of service 11/20/07, and the billed amount on the claim is $200.
At Omega, protection of healthcare information is of paramount importance to us. All our employees go through extensive HIPAA training. Not only are we fully HIPAA compliant, we've also received ISO certifications for both process and infrastructure.
Omega has invested millions of dollars in our IT and security infrastructure, and we have recently upgraded our voice and data networks to scale and support the fast growth of our clients. Connectivity to our clients is continuously monitored 24/7 by our IT help desk. We have the most recent FM200 fire control systems installed throughout the building, 2 large diesel generators that act as a backup to each other, and a large UPS farm to regulate and provide backup power. At Omega, we take HIPAA compliance, PHI, and security very seriously. All visitors and employees entering the building are checked thoroughly, and all laptops are registered. No cameras or other technical equipment is allowed inside the building unless approved by senior management. Employees use a dual mechanism of card access and fingerprint-based biometric access to gain entry into their respective production floors. There are more than 40 closed-circuit video cameras in all areas of the building, including production floors and outside perimeters. These cameras feed live images to a security control room that is monitored 24/7, with any irregularities reported immediately for further action. The secure ID card is also required to exit the production floors, and the timings of entry and exit are all recorded. Lockers are provided to all the employees to leave their personal belongings, and this is strictly monitored and enforced. Cell phone usage on any production floor is expressly prohibited. Omega has a second facility in another city which acts as a backup to our Bangalore operation, in which we provide all the same services. Our operations center in Chennai provides our clients with complete business continuity in the event of a disaster. The Chennai facility is interconnected to the Bangalore facility, and both of them are independently connected via the Atlantic and Pacific to our U.S. co-location facility in New Jersey for the most robust possible connectivity and uptime. Our senior management team in India has a tremendous amount of expertise, not only on the domain side, but also on the operational aspects of how to run a successful healthcare business and knowledge process outsourcing company. Our clients come to us for a variety of reasons. While cost reduction is the most obvious one, there are other factors that play a very important role when choosing Omega. For instance, our clients are growing at a very fast pace, sometimes doubling and tripling in size. And at Omega, they can come to us and get the infrastructure, the computers, everything that they need without going out and spending the money themselves. Here's a testimonial from one of our largest clients that have been with us for a number of years.
My name is Mary Green. I'm with HBR. It's an emergency physician billing company in the United States. My relationship with Omega started 3 years ago when I decided to move my cash posting process. I was able to improve my turnaround time, improve my quality, and reduce costs significantly in my operations. I have insurance verification over here, medical coding, and have just started accounts receivable. I am so impressed with the structure of the company and the way the employees are situated. They're monitored, they're mentored, they're developed, and they're experts at what they do. Their quality and production standards are met, and we will continue this relationship.
Bye.